Hello everyone, welcome back to Radiology Made Easy, your all-time favorite YouTube channel.
Hello everyone, welcome back to Radiology Made Easy. So I'm going to discuss a new topic in how to approach series, that's how to approach CT brain. In this video I'm going to describe how to identify CT windows or different sequences and identify common CT pathologies. So first, the common thing we do is non-contrast CT brain. So this is the axial section taken at the lateral ventricle levels. So when you are dealing with CT, we describe the attenuation or density, whether it has a high attenuation or a low attenuation. High attenuation or high density seen as white color like this, here the bone, skull bone, and low attenuation is seen as dark color or black color like in the lateral ventricles. So fluid has low attenuation or low density. Bone and calcium they have a high attenuation or high density. So this is the white matter, it has myelin or lipid, so it has low attenuation. This is gray matter, it has high attenuation. So these are coronary plexus with calcification, they have high attenuation. So that's the non-contrast CT brain. So we identify ventricles, gray matter, white matter, bone. So those are the key anatomical structures. Next thing, we can get reformatted images. So this is a sagittal image, CT reformatted sagittal image. You can see midline sagittal section. You can see the pituitary gland here. So you can see the spinal cord, brainstem, the vermis. So the next one, we can create coronal reformatted images also in CT. Then also we can change the window. That's earlier I showed the brain windows. This is the bone window. We can change the window width and level and see the bony structure. So this is a bone window. You can see the bone clearly with high attenuation in the bone. So it's one advantage in CT to find out bone pathologies. So this next thing is contrast CT brain. So you can see the vessels here. So you can see the vessels in the subarachnoid space. So this is when the contrast is given. You can see the venous sinuses. So this is a contrast enhanced CT brain. So next thing is CT cerebral angiogram, or this is arteriogram, the subtracted image, and 3D reconstruction done in a subtracted image. So you can see the arterial structures clearly. So it's another important point in CT. You can get a high resolution angiograms. Other than it is not seen in MRI, you can't get high resolutions one, but in CT you can get high resolution ones. It's another one, subtracted venogram. You can see the veins, superior sagittal sinuses, those things. You can sigmoid sinuses, transverse sinuses. So those are the things. So see, this is a CT venogram. You have to give contrast to get these images. In MRI you don't have to give contrast. We can get without contrast. So this is the 3D reconstructed skull image. It is important in identifying fractures. So it's another advantage in CT. So let's see some common pathologies in CT. So it's a infarcted delay. You can see low attenuation in the right MCA territory or right middle cerebral artery territory. So you can see a infarctions or low attenuation, well defined low attenuation area. So it has a mass edema. So that's why there's midline shift. So this is low attenuation compared to normal brain parenchyma here. So it's a MC infarction. The margins are clearly seen, you can see. Next one is the fractures. It's a bone window. So you can see depressed skull fracture. So that's an advantage in a bone window. Depressed skull fracture. You can see it's a comminuted fracture. You can see some low attenuation air pockets also. Next thing is hemorrhages. Hemorrhages either intracerebral or extracerebral. Intracerebral ones we call intraxial, extracerebral ones extraxial. So it's an intracerebral hemorrhage in the left frontoparietal region. So it's high attenuation. Bleeding has high attenuation, so it's bleeding. Hematoma, it's high attenuation. There's low attenuation, perilesional edema in the surrounding. So it's acute one. Acute bleeding has high attenuation or white color. Next one is extraxial ones. They are extradural ones, subdural ones, and subarachnoid. So extradural one, you can see that biconvex appearance here. So high attenuation means acute bleeding. It's outside the brain parenchyma, within the skull, and also there's a scalp hematoma also. So it's a acute extradural hemorrhage or hematoma. And one is, this is crescent shape or biconcave shape. So it's a acute SDH. You identify those things by the shape. It does not cross the midline. So it is high attenuation, so it's acute. So it's crescent shape, acute SDH. You can see a burr hole also here, previous intervention. Then chronic ones. It is low attenuation. It has a low attenuation, and you can see it's also crescent shape, so it's a chronic SDH. So it has low attenuation. Shape is crescent shape. So there's a midline shift, you can see, shifted midline shift to the right side. Yeah. The next thing is SH. You can see the blood in the subarachnoid space. They are seeding towards in the sulci. Blood in the sulci, you can see. So it's an SH. High attenuation means acute. So it's an acute SH. These are the regions blood present. Next one is intraventricular hemorrhage. You can see the high attenuation within the lateral ventricle. In the male, in the both right and left more than right here. So high attenuation within the lateral ventricle. So it is acute intraventricular hemorrhage. Next one is hemorrhage with low attenuation areas here. Hemorrhage with low attenuation areas, and you can see high attenuation areas. Those are hemorrhages. Actually, it's a hemorrhagic transformation of venous infarction. So it's another entity you can detect in CT. The one is soils, neoplasms, metastasis. So you can see high attenuation lesion here with surrounding low attenuation areas. Those are perilesional edema. High attenuation lesion is likely due to hemorrhagic metastasis. So it's a mass here with perilesional edema, and it's a hemorrhagic mets. The last thing is abscesses. Abscesses have a rim enhancement. You can see characteristic rim enhancement in contrast CTs. So centrally cystic area or low attenuation area with rim enhancement. So those are abscesses. There's associated perilesional edema. Rim enhancement typical in abscesses. Sometimes they are seen in metastasis also. So it's time to conclude the CT approach. So I described how to approach CT and also how to identify common pathologies. So please subscribe our YouTube channel, then you'll get notifications of our new videos, and also you can comment on our videos. Thank you.
Thanks for watching. Please like and subscribe for more videos like this.